The aorta provides the blood supply to the pelvic structures. It bifurcates at approximately L4 to L5 into the right and left common iliac arteries. The inferior vena cava, where the right and left common iliac veins return their blood flow, is located to the right of the aortic bifurcation. The ovarian vessels arise from the abdominal aorta. The right ovarian vein returns to the inferior vena cava, while the left ovarian vein returns to the left renal vein. They travel in close proximity to the ureter along the medial aspect of the psoas muscle and supply the ovaries through the infundibulal pelvic ligament or suspensory ligament of the ovary. Here is a laparoscopic view of the left lower quadrant. These are the left ovarian vessels traveling just lateral to the psoas muscle. Medial to the psoas muscle lies the inferior mesenteric and left colic arteries. The genitofemoral nerve lies on the surface of the psoas muscle. The left ureter is seen in close proximity to these structures, which can be identified via its peristalsis. The superior rectal vessels are also seen medial to these structures. This illustration depicts the relationship of the pelvic ureter to the iliac vessels and the anterior branches of the hypogastric artery. The ureter is most easily identified at the pelvic rim, where it crosses over the bifurcation of the common iliac to the external iliac and internal iliac arteries. The internal iliac artery is also known as the hypogastric artery, which branches into the anterior and posterior divisions. The anterior division of the hypogastric artery branches into the obliterated umbilical, superior vesicle, and uterine artery. Note the ureter travels medial to the uterine artery, then travels inferior to the uterine artery to enter the bladder, hence the saying, water under the bridge. This is a fluoroscopic view of the uterine artery as it branches off the internal iliac artery and enters the uterus. In this patient, a fibroid is seen distorting the anatomy and the vasculature of the uterus. Because of the collateral blood supply of the uterus, achieving hemostasis during hysterectomy requires securing the three main arterial supplies: the uterine artery, collateral flow from the ovarian vessels that is supplied via the uterovarian ligament, and collateral flow inferiorly from the vaginal arteries. Because of the close proximity of the ureters to each of these vessels, many of the fundamental steps of a hysterectomy revolve around securing this collateral blood flow while avoiding ureteral injury. Securing the uterine vessels and anastomosing vaginal vessels requires a sequential series of clamping and suture ligation down the side of the cervix on each side until the vagina is entered. Each clamp is placed medial to the previous one in order to avoid ureteral injury. With each sequential ligation, the ureter is deflected more laterally. In this patient, a more extensive retroperitoneal dissection has been performed, revealing the left external iliac vein, which covers the left obturator fossa, the obturator nerve, the obliterated umbilical artery going towards the anterior abdominal wall, the superior vesical artery traveling towards the bladder, and the uterine artery.